Hello and welcome. I'm Dr. Jessica Richardson, board-certified urologist with over 30 years of experience specializing in men's health. Today, I'm addressing something many of my patients think about, but rarely discuss openly: self-pleasure after 60. Let's be frank. Masturbation doesn't end at any particular age. It's a natural part of human sexuality throughout life. However, as we age, our bodies change, and practices that worked in our younger years might require adjustments to maintain both pleasure and health. Why am I passionate about this topic? Because in my decades of practice, I've seen countless men suffering needlessly from issues that could have been prevented with proper education. Today, I'm sharing what I've learned to help you maintain your sexual health and enjoyment for years to come. The truth about male sexuality after 60. Before we address specific practices, let's dispel some myths. Myth 1. Sexual desire naturally disappears with age. Reality. While hormonal changes may affect libido, studies show that sexual desire persists well into our 80s and beyond for many men. What changes is not necessarily the desire itself, but how our bodies respond. Myth 2. Erectile dysfunction is inevitable and untreatable. Reality. ED becomes more common with age, but it's not universal, nor is it simply something to accept. Many causes are treatable, and proper techniques can help maintain function. Myth 3. Self-pleasure is harmful or inappropriate for older men. Reality. Regular sexual activity, including masturbation, can actually improve prostate health, reduce stress, improve sleep quality, and maintain sexual function. Now, let's address the key practices that might be silently affecting your health and how to correct them. Mistake 1. Using excessive pressure or death grip. The problem? One of the most common issues I see in my practice involves men who have accustomed themselves to extremely firm grips during masturbation. This practice, sometimes called death grip, can lead to several problems. Decreased sensitivity over time, difficulty achieving satisfaction with a partner, potential tissue damage and pain, exacerbation of erectile difficulties. The biology is straightforward. Persistent excessive pressure can cause temporary desensitization of nerve endings. When this happens repeatedly over years, the threshold for stimulation increases, creating a cycle where more pressure seems necessary. The solution: progressive pressure reduction technique. Awareness is the first step. Take note of your current grip pressure. Use lubricant. This naturally reduces friction and the need for pressure. Gradually decrease pressure over time. Try a 3-week step-down approach, consciously using less pressure each week. Explore different techniques that don't rely on pressure, such as focusing on different areas or using gentle massage movements. Practice interval training. Alternate between your usual technique and gentler approaches. Robert, 68, shared, "I didn't realize how my technique was affecting me until my doctor mentioned it. After following his advice for about 2 months, I noticed significantly improved sensitivity and actually greater satisfaction. As men age, natural skin moisture decreases significantly. The skin becomes thinner, and its ability to withstand friction reduces. Yet many men continue masturbating without appropriate lubrication, leading to micro tears in delicate tissue, painful irritation, increased risk of infection, reduced pleasure. The biological changes are unavoidable. After 60, skin loses approximately 20% of its moisture content compared to our 30s, and the sebaceous glands produce significantly less natural oil. The solution: proper lubrication strategy. Choose age-appropriate lubricants. Water-based lubricants are generally safe and easy to clean, but older skin may benefit from silicone-based options that last longer and provide more moisture. Avoid products with alcohol, glycerin, or fragrances, which can cause irritation or dryness, especially in sensitive skin. Apply lubricant generously before beginning and reapply as needed. Consider specialized products designed for sensitive skin if irritation occurs. After activity, gently clean the area with mild soap and warm water. Then apply a fragrance-free moisturizer to help skin recover. Personal experience from George, 72. Using proper lubrication transformed the experience entirely. Not only is it more comfortable, but I've stopped experiencing the irritation that used to bother me for days afterward. Mistake 3. Poor timing and duration. The problem. Many men maintain youthful habits regarding timing and duration, which can create problems including physical strain on the heart, excessive fatigue, frustration from changing response times, medication interference. After 60, the body's sexual response cycle naturally changes. Arousal typically takes longer, physical stamina may decrease, and recovery periods extend. Fighting against these natural changes rather than working with them often leads to disappointment. The solution: age-optimized timing approach. Schedule intimate time when energy levels are highest. For many older men, this is in the morning when testosterone levels naturally peak, rather than late at night. Allow for extended arousal periods. Consider spending more time with fantasy, visual stimulation, or other forms of mental arousal before physical touch. Practice mindfulness during the experience. Focus on sensations rather than performance goals. Understand medication timing. If you take medications like blood pressure drugs or antidepressants that might affect sexual function, consider timing self-pleasure accordingly. Accept that sessions may take longer than in youth and build this understanding into your expectations. James, 67, notes, "Once I stopped trying to rush through like I did in my younger days and instead took my time, the experience became much more satisfying. I now see it as quality time for myself rather than just a physical release." Mistake 4. Ignoring pelvic floor health. The problem. The pelvic floor muscles play a crucial role in sexual function, yet they're often neglected. As men age, these muscles naturally weaken, potentially contributing to erectile difficulties, decreased ejaculatory control, reduced sensation, potential urinary issues. By age 70, many men have experienced up to 30% reduction in pelvic floor muscle tone, yet few take steps to counter this natural decline. The solution: pelvic floor fitness program. Identify your pelvic floor muscles. These are the muscles you use to stop urination midstream. Practice basic Kegel exercises daily. Contract these muscles for 3 to 5 seconds, then relax for 3 to 5 seconds. Start with 10 repetitions 3 times daily. Progress to advanced Kegels. Once basic Kegels become easy, try holding contractions for 10 seconds, then relaxing for 10 seconds. Add quick flicks. These are rapid contract and release movements that help improve responsive control. Incorporate pelvic floor awareness during masturbation. Try contracting these muscles during the experience to increase sensation and control. Clinical evidence shows that men who regularly practice pelvic floor exercises report up to 40% improvement in erection quality and sexual satisfaction after 3 months of consistent practice. Michael, 74, reports, "My urologist suggested pelvic floor exercises after I mentioned some difficulties. Within about 2 months of daily practice, I noticed significant improvements in both control and sensation." Mistake 5. Problematic positions and ergonomics. The problem. Many men maintain the same physical positions for self-pleasure that they used in youth, despite developing joint problems, decreased flexibility, back issues, circulation changes. These inappropriate positions can lead to pain during or after the activity, temporary numbness, exacerbation of existing conditions like arthritis, unnecessary strain. The solution: ergonomic approach to self-pleasure. Support your body properly. Use pillows to reduce strain on the back, neck, and joints. Change positions periodically during longer sessions to prevent stiffness and improve circulation. Consider seated positions with back support. If standing or lying flat causes discomfort, be mindful of wrist and hand positioning to prevent aggravating conditions like arthritis or carpal tunnel syndrome. Try side-lying positions, which often reduce pressure on the lower back and improve blood flow. Thomas, 79, shares, "Adjusting my position and using proper support made a tremendous difference. I no longer experience the back pain that used to follow, and I can enjoy the moment without physical discomfort." Mistake 6. Medication unawareness. The problem: many men over 60 take multiple medications. Some of these can significantly impact sexual function and sensation, including blood pressure medications, antidepressants, antihistamines, cholesterol-lowering drugs, pain medications. Using masturbation techniques that don't account for these medication effects can lead to frustration, overexertion, and potential injury. The solution: medication-aware approach. Know your medication's side effects. Ask your doctor or pharmacist specifically about sexual side effects of any medication you take. Track patterns of how your body responds relative to medication timing. Consider timing intimate activities for when medication effects are minimal, when appropriate. Discuss alternatives with your doctor if a medication severely impacts your sexual function. Never adjust medication dosages without medical supervision, but don't hesitate to discuss sexual side effects with healthcare providers. William, 65. After starting blood pressure medication, I noticed changes in my response. Instead of giving up, I spoke with my doctor, who suggested timing changes and eventually a different medication with fewer sexual side effects. The conversation was brief, but solved a significant problem. Mistake 7. Isolation and psychological disconnection. The problem: many older men, especially those who are widowed or single, approach self-pleasure from a purely physical perspective, missing the psychological and emotional components that enhance the experience. This can lead to decreased satisfaction, emotional emptiness, reinforcement of loneliness, potential depression. Research suggests that sexuality remains closely tied to mental health throughout life, and treating it as merely mechanical can diminish its benefits. The solution: holistic approach to self-pleasure. Create a positive mindset around the activity rather than viewing it as merely physical maintenance. Incorporate fantasy, memory, or appropriate visual aids to engage the mind fully. Practice mindfulness during the experience, focusing on sensations and pleasure rather than just the end goal. Consider the emotional context. Self-pleasure can be an act of self-care and self-love, not simply physical release. Stay connected to your sexuality through reading, education, and positive thoughts about this aspect of your life. Research indicates that men who maintain a positive attitude toward their sexuality report 60% higher satisfaction with intimate activities, regardless of relationship status. Edward, 81, widowed for 5 years. Learning to approach self-pleasure as a form of self-care changed everything. It's no longer just a physical act, but something that helps me stay connected to myself as a complete person. The importance of regular health monitoring. As you maintain your sexual health through improved practices, remember that regular monitoring plays a crucial role. Prostate Health schedule annual prostate exams after 50, earlier if you have family history. Be aware of changes in urination patterns. Understand the relationship between sexual activity and prostate health. Cardiovascular connection. Sexual function often serves as an indicator of cardiovascular health. Report new or worsening erectile difficulties to your doctor. Maintain heart-healthy habits that also benefit sexual function. Skin health. Regularly examine genital skin for any changes. Report persistent irritation, rashes, or unusual spots. Consider annual dermatological checkups. When to seek professional help. While the advice in this guide addresses common issues, certain symptoms warrant prompt medical attention: pain during or after masturbation that persists or recurs, sudden changes in sexual function or sensation, unusual discharge, bleeding, or skin changes, psychological distress related to sexual activity, new onset of difficulty achieving or maintaining erections. Remember, Healthcare professionals are trained to discuss these issues without judgment. Your concerns will be treated with respect and confidentiality. The bigger picture: sexual health is part of aging. Maintaining healthy intimate practices is just one component of successful aging. Consider how it connects with overall physical health. Regular exercise improves blood flow and stamina. Proper nutrition supports hormone production. Adequate sleep enhances sexual response. Limiting alcohol improves function. Mental well-being. Reduced stress improves sexual response. Positive body image enhances experience. Managing depression and anxiety benefits sexual health. Maintaining brain health preserves sexual imagination. Social connections for partnered men. Communication about changing needs. For single men, acknowledging intimacy needs as normal and healthy. Building non-sexual connections that support overall well-being. Practical daily habits for lifelong sexual health. Beyond specific masturbation techniques, these daily practices support ongoing sexual wellness. Hydration. Drink at least 64 ounces of water daily to maintain mucous membrane health and overall function. Kegel exercise. Incorporate 3 5-minute sessions of pelvic floor exercises into your daily routine. Walking. 30 minutes daily improves circulation to all parts of the body, including genital tissues. Stress management. Practice 10 minutes of mindfulness or deep breathing daily to lower cortisol levels that can interfere with sexual function. Sleep hygiene. Prioritize 7 to 8 hours of quality sleep to support hormone production. Genital care. Use mild soap and moisturizer appropriate for sensitive skin. Mental exercise. Maintain brain health through reading, puzzles, and learning new skills to support the cognitive aspects of sexuality. Conclusion: embracing healthy sexuality at every age. As we've discussed, maintaining healthy self-pleasure practices after 60 isn't just about physical technique. It's about embracing this natural aspect of human experience in ways that support your overall health and well-being. The common thread running through all 7 areas we've covered is mindfulness, being aware of your body's changing needs and responding appropriately rather than clinging to habits that may no longer serve you. Remember that sexuality doesn't have an expiration date. With the right approaches, intimate pleasure can remain a fulfilling part of life well into your 80s and beyond. The key is adaptation, education, and maintaining a positive attitude toward this important aspect of human experience. Your action plan. Next steps. To implement what you've learned today, evaluate your current practices in light of the 7 areas we've discussed. Choose one area to focus on first, rather than trying to change everything at once. Track your progress by noting improvements in sensation, satisfaction, and any reduction in problems. Schedule a checkup with your healthcare provider to address any underlying concerns. Continue your education through reputable resources on aging and sexuality. Frequently asked questions. Question: is it normal to notice changes in ejaculation as I age? Answer: yes, completely normal. The volume typically decreases, and the force of ejaculation may diminish. The refractory period, time needed before another erection is possible, also lengthens with age. Question: can certain health conditions affect masturbation practices? Answer: absolutely. Conditions like diabetes, heart disease, arthritis, and neurological disorders can all impact sexual function and may require adaptations to technique. Question: are there specific lubricants better suited for older men? Answer: yes. Products with hyaluronic acid can provide longer-lasting moisture. Silicone-based lubricants generally work well for older skin, but aren't compatible with silicone toys. Avoid products with glycerin if you're prone to irritation. How often is normal for masturbation after 60? Answer: there is no standard frequency that applies to everyone. What's normal is what feels healthy and satisfying for you. Some men maintain daily practices, while others prefer weekly or occasional self-pleasure. Question: can masturbation help prevent erectile dysfunction? Answer: Research suggests that regular sexual activity, including masturbation, helps maintain erectile function through the use it or lose it principle. Regular blood flow to erectile tissues helps maintain their health. Question: is it ever too late to make improvements to technique? Answer: it's never too late. The body continues to respond to positive changes at any age, and many men report significant improvements in function and pleasure after making adjustments even in their 70s and 80s. Question: what if I'm taking medications that completely prevent erection? Focus on pleasure rather than erection. Many men can experience orgasm even without a full erection. Discuss with your doctor the possibility of medication adjustments or additional treatments if sexual function is important to you. Question: how do I talk to my doctor about these issues? Answer: be direct and remember that healthcare providers are professionals trained to discuss these topics. Start with a statement like, "I'd like to discuss how aging has affected my sexual function," or "I'm experiencing some changes in my sexual response and would like some guidance." A final word of encouragement. Maintaining healthy, intimate practices is a gift you give yourself. It supports physical health, emotional well-being, and quality of life. By making informed adjustments as you age, you ensure that this important aspect of human experience remains positive and life-affirming throughout your journey. Remember that you're not alone in navigating these changes. Millions of men are asking the same questions and facing similar challenges. With knowledge, adaptation, and a positive attitude, intimacy can remain a source of pleasure and well-being for a lifetime. Most importantly, approach this aspect of your life with the same care and attention you give to other areas of health. You deserve to maintain pleasure, function, and satisfaction throughout your entire life journey. Thank you for taking this important step toward healthier intimacy practices. Your commitment to self-care in all its forms is the foundation of aging well. Your health is your greatest asset. Protect it with knowledge. If this video helped you or someone you love, don't keep it to yourself. Share it. Hit that subscribe button and tap the bell icon so you never miss a tip that could change your life. And remember, it's never too late to take control of your well-being. Stay strong, stay informed, and as always, take good care of yourself. We'll see you in the next one.